topic of the today's discussion is precautions and do's and don'ts during first trimester of pregnancy. Hello and hi everyone. This is Dr. Sravanthi Reddy, fertility specialist and gynecologist at Shubha Fertility. The topic of the today's discussion is precautions and do's and don'ts during first trimester of pregnancy. So the major thing first you have to do the moment you get pregnant or you know that you are pregnant, when you have a missed period, it's always better to meet the gynecologist or obstetrician at the earliest. So basically previously they used to wait till 3 months and then they'll visit the doctor. It is always safe to meet the doctor at the earliest so that you will be evaluated properly and treat anything. If you are evaluated and you have diagnosed with anything, it is easy to treat at the earliest. It won't affect the baby. So initially when you go to the doctor at the first visit, they'll take your history. If you have any any medical conditions, or you have suffering with any hypertension, or already you're a diabetic, or you have any thyroid disorder, so we'll send basic investigations, and accordingly we'll start the medication so that it won't affect the baby. And basic investigations are done, and then we'll advise you for a basic scan at 6 to 7 weeks. That is the early scan we'll do, early pregnancy scan, and it is called a viability scan. So in the scan we'll check for the the location of the baby. Is it in the uterus or it is outside the uterus? So it is very important because ectopic pregnancies are can lead to emergency or surgeries. It can get ruptured and it lead to an emergency surgery. So it is always better to check the location at the earliest. So that is the one thing we'll see in 6 to 7 week scan: ectopic, intrauterine, or it is outside the uterus. Or next thing is we check the viability, that is baby's heartbeat is present or not. And next thing we see is the dating scan. So these are the three things we see. And next comes that if it is a multiple pregnancy or a singleton pregnancy also, we can find out in 6 to 7 weeks of scan. And then the moment you visit the doctor, we'll advise you with a basic medication like folic acid, that is vitamin B9. It is very important to take folic acid as soon as you get pregnant, or if you're planning pregnancy, it is always better to start 3 months before planning the pregnancy. Folic acid is a very important medication, vitamin. It will help to prevent any neural defects in the baby. So it is always better to take before 3 months of the conception. Even if you have not taken, it is better to take it start at the earliest. So folic acid is advised immediately. And see, if you are in medication previously, like if taking any drugs for any certain condition, so we will just look at your history, and then according to your the medication, we'll see if there is any possibility to continue the medication, because some medications are have a negative impact on the baby. So we'll try to change the medication which is suitable to the pregnancy. That is what we can do when you visit early. Next comes the diet. Diet is very important once you get pregnant. So we'll advise you a well balanced and nutrition diet, high protein diet if you can consume in the first 3 weeks of pregnancy. And we'll tell you to have a good amount of lots of vegetables and lots of fruits. And next comes, if you're any addictions like smoking or alcohol, always advisable to stop it immediately. Any amount of alcohol is not good, any amount of smoking is not good. Completely avoid any addictions immediately when you know that you're pregnant. See, there is a chances of fetal alcohol syndrome in patients who are consuming alcohol, the chronic alcoholics. So the moment you will know that you are pregnant, it is better to stop all the addictions you've been addicted to previously. Suppose this, we also ask you to stop consuming too much of caffeine, because the people who are very much addicted to caffeine also, there is a recommended dosage of caffeine 200 mg per day, not more than that. These are the things we are going to advise you once you are immediately pregnant or you come to the obstetrician. It is better always to consult the obstetrician at the earliest, so you will have a healthy pregnancy ahead. And in the early trimester also, you have the people will have morning sickness. Sickness might even go throughout the day, even they have evening, and some people have throughout the day also. Even such cases, we have a medication we can make and start early so that you won't have that sickness. So it is always better to consult at the earliest. Thank you and follow me for more content.